This program is brought to you by Emory University.
The idea here of predictive health is, could we, in fact, identify changes that will lead to disease before the disease occurs? Changes in whether it's our genome, whether it's our proteome, our metabolomics, anything that could begin to change. Could we, in fact, identify it early and get it back into the right track? So some of it is like inflammation, a real simple example. We measure C-reactive protein, which anybody can measure in theory, but you follow it over time. It's a marker of inflammation. If that goes up, are there ways we can actually bring it back down? So if inflammation is associated with diabetes or heart disease or arthritis, and it is, can we in fact have an impact that way? So can we predict changes that affect our health and then preempt the changes with new ways and new approaches? And we look at this from not only sort of the genetics, but behavior and environment, because they all interact.
What we argue for predictive health is, but if you could keep people from getting those diseases for a longer period of time, then you'd avoid the disease care costs and prolong the productive lives of people, and that would be both more cost-effective and more effective in terms of human values and experiences than focusing on disease care. So if we could decrease, in my view, the only hope for containing overall healthcare costs is to keep people healthier for longer so that you decrease the need for expensive disease care.
If we could predict disease before it occurs, I mean, that would be terrific to start with. And to some extent we can. You know, some complicated genetic disease, and there's a handful of them, you can predict that you've got them. The question is, if you have no treatment, do you really want to know? And when do you want to know? And that's a perennial debate. There's a lot of ethics that will have to be considered here and the economics. But my sense is that this is a track that is going to move forward no matter what, and that over time we will have more and more tools, better technologies that allow us to do the kind of measurements that we need to do at next to no cost or lower cost. And then we can use that information to help inspire people to do their own care of staying healthy.
Predictive health is not early diagnosis. This is never getting to a diagnosis. It's measuring things that define health and looking at the earliest deviations and intervening then, rather than waiting until your blood sugar is elevated. By the time your blood sugar is elevated, you've had the metabolic abnormality for years. And that's just the sort of final phase of this abnormality. If you could intervene way north of that, if you will, or I guess east of that, depending on how you're oriented, then it ought to be a lot more cost-effective in terms of delivering care, but also would prolong productive years for people and contribute to well-being. How can we keep people on track so you don't ever develop diabetes, even though you're at risk for diabetes? That would be big. If you look at, our epidemic of type 2 diabetes in this country is enormous, and that's driving healthcare costs. Ken Thorpe, a local expert, attributes, I can't remember, but is it a third? A quarter of our healthcare costs in this country are due to obesity and the subsequent diseases that follow it, like diabetes, hypertension, heart failure. So if we can kind of get at this earlier and, make a difference here by encouraging people to have a different health behavior, or it might actually mean that we might use a different kind of a therapeutic that actually alters the system, that gets us back on a track of health. This is not medical care that we're talking about. It's health care. The way we've used the term medicine and medical care is the disease-oriented paradigm. And that's the way we operate and have since, I started to say since the dawn of time. That's not true. The very early shamanistic-based approaches to health weren't very scientifically based or biology-based. But at least since the Flexner Report and the introduction of the incredible, powerful science that has made medicine a real discipline, we've tended to ignore a lot of the other factors that influence what health is, and that if we can change the paradigm to this health-focused approach, it'll change how we educate healthcare professionals, and it'll change how doctors approach, quotes, patients. You shouldn't even be a patient when you first encounter the healthcare system. You should be a healthy person, and you shouldn't become a patient for as long as possible, for as long as it's possible to keep you from being categorized that way. There'll still be a need for people to care for people with disease. Obviously, we're not going to stamp out all disease, but with time, it should be possible to shift the care burden, if you will, away from disease, and particularly chronic and terminal disease, to keeping people healthier.
We're seeing already people, as their health awareness increases, improving their health status. And I think this should spread like wildfire and should be a model that's being used around the country. If I, as a patient, I like it, I demand it. I want it as a patient, I want it for myself. And I'm not a health nut, but I do want to live long and die fast.
The contrast with disease care, which is what we do, we don't do much health care. We want to really do health care, is that it's predictive, not diagnostic. If you enter the current, quotes, healthcare system, your health professional is trying to make a diagnosis. And if you can't make a diagnosis, or she, they lose interest because you don't fit the disease paradigm. They don't know where to go from there. So focusing on health and prediction rather than diagnosis. Health instead of disease, prediction instead of diagnosis.
How do we keep people healthy until they die? And that should be a goal. Is it possible? I think it is possible. In my lifetime, I don't know if we'll make it. It'd be great. I'd like it. Wouldn't you?
It's not preventive medicine. It is contrast to that. Preventive medicine is aimed at preventing a disease, okay? So you have a heart disease prevention program, or you have a cancer prevention program, is aimed at modifying factors that put you at risk for that specific disease. And those are good programs, absolutely. But we're talking, again, way before you get there. And there are some common metabolic changes that are part of all those diseases. An example is inflammation. So inflammation is an important part of diabetes, heart disease, Alzheimer's disease, cancer, most of the chronic diseases that people suffer from. So if you could understand the pathways that are involved, the body pathways that are involved in inflammation, measure them, define what's really healthy, and detect the early deviation, you could have a health maintenance, if you will, or health retention program that would not be disease-specific at all, but rather would be focused on health. It's a little nuanced, but not terribly after you spend some time thinking about it, to realize that focusing on health is a radical change from the way we do care now, which is disease care.
The technology that allows you to sequence the human genome has gotten to be less and less expensive. So the first human genome was sequenced, one genome, for $3 billion. I know you can buy that, but I can't quite get there. I mean, it's a little expensive, right? Well, now you can get it done for $7,000. Still expensive. But the projections are, because of technologies that are developed to make it more efficient, it's going to be $1,000. Next thing you'll know, some of the work a person like Dean Jones is doing, you can throw that on top of it, measure all these metabolites. Well, today it's expensive. But if you can take the genome from $3 billion to $1,000, You ought to be able to take something that might cost $100 million to $1,000, or maybe down to $10. And that will happen. That will happen. So I think all the research that has to support this is happening now in various variety of kind of ways, and somebody has to synthesize that. And in a way, predictive health is this great synthesizer of, extant information and trying to bring in new knowledge to bear on that and engage the patient in a full and meaningful way to make this powerful difference that allows us to achieve this vision goal that we have for predictive health.
Let me use one of the illustrations from the book. We call on our experiences with two patients, if you remember, with very different people and with very different health experiences. So one of them was Carlton Hensley, who was not his real name, who died at the age of a little over 60 of serious complications of diabetes, cirrhosis of the liver, and a variety of infections and other complications. So he didn't have to do that. Type 2 diabetes and cirrhosis of the liver, by and large, are preventable diseases. So that if somewhere early, while he was still healthy, those risks could have been identified, and he could have been engaged in a lifestyle program that would have prevented developing those diseases, he could have lived perhaps not to 100 like Ms. Eck, the other patient we referred to, did, or the person did, but for a lot longer than and a lot more productively than he did. So a lot of the chronic disease that plagues our nation is preventable, and identifying people at risk very, very early, and the earliest deviation from the healthy state, rather than waiting for disease to develop, we think has the promise of making people healthier, happier, and more productive. You're not healthy on an island by yourself. I mean, you are in the context of the society, the people you're around. All those things affect whether you're healthy or not. So it's both a personal, there's a lot of personal information about what you can do about your health, but it's a bigger view of sort of a prescription for how one approaches health care that's very, very different than the disease care approach that we have now.
The preceding program is copyrighted by Emory University.